Hello, everyone. I'm Dr. Jennifer V. Brown, your stroke specialist, and I'm aging gracefully with the stroke diagnosis due to sickle cell disease. Today, we're going to discuss how to improve hemiplegic movement of the lower extremity during swing phase of walking. I use the Bobath method from neuro-developmental treatment training in order to facilitate swing phase. I start proximal and go distally based on the impairment of the pelvis and the lower extremity. So in the first video, this person has really great movement of the lower extremity. Therefore, I need to focus on the pelvis. I create a torquing movement this way with my fingers to help facilitate the swing, but really it's the pelvis that rotates forward because they have great activity in their lower extremity. In the second video, my colleague is going to demonstrate a person who has difficulty moving the thigh forward, and therefore I have to use my forearm. So in this video, I'm doing a whole lot more work at that lateral hip and getting my forearm behind the lateral portion of the thigh to facilitate the movement. And of course, the position of my fingers help guide the pelvis forward. Now, in the third video, she's demonstrating someone who really doesn't have great leg control. And look how much work I have to do. My shoulder at the pelvis, my hand to help derotate or increase rotation of the femur, and how I have to facilitate knee flexion with my opposite hand. And as you can see, that's a whole lot more work with me having to move the body. So in the future, you're going to learn what we do to get rid of the ankle concerns and put the foot into dorsiflexion. But we can always make swing phase easier with equipment. So look what I've done. I've taken TheraBand, and based on the weakness of the lower extremity, if there's knee hyperextension, I use a different tension color. But it is so easy to get the leg to come forward if you can take a long step with the less affected leg and push the rolling walker forward. And if you need more control closer to the center of mass, look where I put the TheraBand, around the knee. But you still have to get a long stride on the opposite side, okay? And that step length as you're pushing the rolling walker forward to create tension so that when you unweight and move your pelvis, the TheraBand will bring the leg through. Now, I know a lot of people are concerned about the lower extremity. If you don't have knee or ankle work, use something easy where the foot can just slide across the floor. Go to Kinematic Concepts for a foot slider, or just use carpet skates. You can get those from a carpet store. But more to come on that. So these are the clinical questions to ask. Is there adequate strength of the hip flexor to advance the lower extremity? Are there alternative exterior devices that can be used to ease the work effort of swing for the lower extremity? And you got to consider, do they have grip strength? All right. And do they have trunk control? Remember, I'm your trusted source for all things stroke rehabilitation and ankle foot orthoses. These videos are posted on Tuesdays and Thursdays. So like, subscribe, and share, and leave a comment. Don't forget about your references. We need evidence-based practice to improve the health outcomes of our clients as we choose different interventions. Thank you for watching, and stay tuned about what to do with that ankle for foot drop. Bye.